Hi guys, today I'm beginning with the anatomy series in which our first topic is going to be anastomosis around scapula. So without much further delay, let's begin the video. So basically anastomosis around scapula. Anastomosis is between the first part of the subclavian artery and the third part of the axillary artery. That's the anastomosis. And what is the clinical significance of it? So anterior dislocation of shoulder joint and head of humerus compresses the second part of axillary artery. You can see in this diagram, this is basically the axillary artery in the head of the humerus. That is this part. It is compressing the second part of axillary artery, and because of the compression, what happens is basically upper limb blood supply is compromised, and this is prevented by anastomosis around scapula. So this is the diagram of basically anastomosis around scapula, showing the posterior view of scapula. So this is the posterior view of scapula, and this is known as the crest of spine. Okay, now what is important is that this is basically first part of subclavian artery. The first part of subclavian artery has the trunk which is known as a thyrocervical trunk, and this is basically TCA. The TCA is also known as transverse cervical artery. So thyrocervical trunk se nikalta hai transverse cervical artery, and also there is one more which is known as basically suprascapular artery. So transverse cervical artery and suprascapular artery. As the word suggests, suprascapular is going to basically from the course of suprascapular, and transverse cervical because here is the cervical spine like this and it goes transversely through it. So transverse cervical and suprascapular artery, basically these two are the parts. Then we have another branch. This branch is known as basically the other branch of the dorsal scapular artery or deep branch of transverse cervical artery, and this is basically known as basically branches of the dorsal cervical artery or also scapular artery. So scapular artery, and then we have basically this part which is known as the circumflex scapular artery and subscapular artery, which are the part of course axillary artery. That's the subclavian artery, that's the axillary artery, and the third part of axillary artery. Okay, these are the parts. And also this is posterior circumflex humeral artery and anterior circumflex humeral artery, and what we have, this is acromial branch of PCH. So if anybody tells what is the anastomosis around the scapula, so the anastomosis include these things. Here what we have in anastomosis, what is this? This is nothing but it's known as a suprascapular artery. What is the suprascapular artery? That's the first part. Second part in anastomosis is this deep branch of transverse cervical artery, and this is basically the branches of transverse cervical artery plus suprascapular artery. This forms the anastomosis, and what we have is basically the third part of axillary artery, and this is the axillary branch of the acromial branch of the posterior circumflex humeral thing. That's the branch. And then what we have is this is superior cervical artery and suprascapular artery and transverse cervical artery. So this is the anastomosis which are formed. So basically that's called as the anastomose. This is the first anastomose. That is, let's revise again. First anastomose between a branch of suprascapular artery and acromial branch of PCH. So we will list over here. That is, first anastomose is between a branch of suprascapular artery plus there is basically anastomose between the acromial branch of posterior circumflex humeral artery. Next, the second anastomose. Second anastomose is between basically the deep branch of TCA, that is the dorsoscapular artery and also between other branches of DCA and circumflex scapular artery, and also it is on the suprascapular artery. So we can also say that second anastomose is between a branch of suprascapular artery then plus dorsocervical artery, and we have basically other deep branches of transverse cervical artery. And the third anastomose what we have is basically in between the circumflex scapular artery, and also here also one more thing is circumflex scapular artery. And the third anastomose is basically between suprascapular artery and the posterior and basically so guys, that's the three anastomoses. Now guys, let's identify and let's see. So what is the identification? So what is this? This is known as basically thoracoacromial trunk. So we'll write it. That's the thoracoacromial trunk. We can write this identification like this. This is the thoracoacromial trunk. Okay. This is thoracoacromial trunk. That is okay. This basically second part or first part of subclavian artery. It's the first part of subclavian artery, and this is thoracoacromial trunk. And now the lateral part which is going below is basically transverse cervical artery. What is it called as? Transverse cervical artery. The part which is going below is known as a transverse cervical artery deep branch. So there are two branches of transverse cervical artery. It's basically one branch is known as deep branch, and then there is basically thyrocervical trunk se nikalti hui suprascapular artery. This is basically deep branch of transverse cervical artery. That's the deep branch of transverse cervical artery. You can write that basically deep branch of transverse cervical artery. And what is this? This is basically, we can also call it as branches of DCA, or we can also call it as a branches of DS, that is dorsal scapular artery. So basically this is known as the branches of dorsal scapular artery, DSE. Now what is this here? Here what we have is basically, this is called as a SCA, that is suprascapular artery. Suprascapular artery. So suprascapular artery. Then what we have over here is this going on acromion process over, and this is known as a branch of suprascapular artery. So what is this? Branch of suprascapular artery. Now what we have here over the shoulder anastomosis which just takes place in a branch of suprascapular artery, and this is known as a acromial branch of PCHA, that is posterior circumflex humeral artery. So this is one anastomosis. Can you see? A branch of suprascapular artery and acromial branch of the posterior circumflex humeral artery. So we had multiple branches, deltoid branch. So this is basically the acromial branch of the posterior circumflex humeral artery and suprascapular artery ka anastomosis. So that's the anastomose number 1. Then what we have is basically this is the thing. Then what is this? This is known as of course axillary artery. So in axillary artery what we have two branches again which provides the second anastomosis, which is second anastomose providing two branches again. Our first is basically here what we can see is this is known as the circumflex scapular artery. What is this? Circumflex scapular artery. So very important, circumflex scapular artery. What is this? Third part of axillary artery. Circumscapular artery, third part of axillary artery. And what we have is this is known as basically circumflex scapular artery. Then what is this? This is again the deep branch. So here we have named. Talking about summary of anastomosis: body of scapula branches from dorsal scapular artery and suprascapular artery. As you can see over here, this is the anastomosis. Here what all are coming? You can see anastomosis. First what we have, what is this? This is known as circumflex scapular artery. Then deep branches of the, can you see, circumflex scapular artery. I'll mark with a different pen here. So this is what you can see, the circumflex scapular artery. These are deep branches of the transverse cervical artery. Then what we have, basically dorsocervical artery and branches of SCAT, suprascapular artery. Where the suprascapular artery? Okay, this. So suprascapular artery के branches, then this circumflex scapular artery के branches, and this is the branches of the deep branches of TCA, and also dorsal cervical artery. Anastomosis number 3. Anastomosis number 2 is what? Deep branches of transverse cervical artery, as you can see, or dorsal scapular artery, or transverse cervical artery, or we can also call it as a dorsal scapular artery. And also between the suprascapular artery. Where is the suprascapular artery? This is the suprascapular artery coming from here, so it cannot be much visible, but this is the second anastomosis. So from this diagram, all the anastomosis are super clear. It is anastomosis takes place between which the branches of basically subclavian and branches of axillary. Between the two things, anastomosis takes place. So branches of subclavian are basically branches from dorsal scapular artery, suprascapular artery, and circumflex scapula. The dorsal scapular and subscapular. Acromial branches of suprascapular and acromial branch of PCA and thoracoacromial, which is basically third part. Now guys, what I'm going to come on is a very important topic, which is known as basically the brachial artery. What is my brachial artery? Basically what happens is, we have to first understand the location of brachial artery. So it's very important to understand that it joins the elbow anastomosis. So location is going to basically close to the elbow. If we consider this as our humerus like this, and here being the cubital fossa, so that's the brachial artery. So basically, where does the brachial artery starts from? So the brachial artery is basically starting off like this. We can see over here like this. Then it gives multiple branches. Like from here starts the anterior and posterior branch, like this part, then this part. So yes, this part and this part. Then so what we have is here the radial groove on the humerus, and this is the brachial artery. This brachial artery starts from here, and it gives a branch which is known as the profunda brachii artery. And then from the profunda brachii artery, after given, here begins basically the brachial artery. Here it again gives a branch which is called superior ulnar collateral artery. That's the one. And here have a inferior ulnar collateral artery. These two artery goes. Basically inferior ulnar collateral artery runs in the same direction. Superior ulnar collateral artery at the condylar region, then it moves backward. This is known as basically a medial epicondyle, and from here the superior ulnar collateral artery moves backward and inferior ulnar collateral artery moves forward. Then what we have is basically another branch of the brachial artery. This is the profunda brachii artery, which is a branch of a brachial artery. This profunda brachii artery then runs posterior to the radial groove, and then basically it supplies the lateral epicondylar lesion. Then what we have is basically again two more branches of the profunda brachii artery. That is, what we have is anterior descending branch and posterior descending branch. Anterior descending branch of profunda brachii and posterior descending branch of profunda brachii. Then what we have is this cubital fossa, and then this brachial artery runs parallel, and basically it gives terminal branches as a ulnar artery and a radial artery. So basically this is how the brachial artery is. What is important to know, the radial nerve runs in the spiral groove of the humerus and continues into the anterior descending branch of basically the profunda brachii artery. That is, this anterior descending branch of profunda brachii artery will run parallel to the radial nerve, which runs to the radial groove of the humerus. And basically anterior descending branch, posterior descending are the branches of the profunda brachii, which is a branch of brachial artery. Brachial artery has other branches also along with profunda brachii, which are superior and inferior ulnar collateral branch. And what we have is basically over here the terminal branches it gives as a ulnar artery and a radial artery. Talking about anastomosis around the elbow. So anastomosis में, as you can see in this diagram clearly, that's the brachial artery. This is known as the superior ulnar collateral artery, inferior ulnar collateral artery. Profunda brachii branch of the brachial artery which gives anterior descending and posterior descending. Now it's important to understand, after giving a branch radial artery and ulnar artery, radial artery is one branch which is known as a radial recurrent artery. Why is it called radial recurrent artery? Because the course of radial artery is like downward and it basically recurs upward, therefore it's called recurrent artery. So basically that's known as a radial recurrent artery. So that's a radial recurrent artery, and this is basically the ulnar recurrent artery. So two, and in ulnar recurrent artery we have two things, which is anterior ulnar recurrent artery and posterior ulnar recurrent artery. This anterior ulnar recurrent artery will anastomose with inferior ulnar collateral artery, and posterior ulnar recurrent artery will anastomose with superior ulnar collateral artery. But here there is no such term that anterior and posterior radial recurrent artery. It's just one radial recurrent artery which anastomose with the anterior descending branch of the profunda brachii branch of brachial artery. And here what we see is basically posterior descending branch, and it is getting anastomosed not with a branch of radial artery, but actually it is getting anastomosed with a branch of ulnar artery, which is ulnar artery gives a branch which is known as anterior and posterior interosseous artery. The interosseous is basically what I'll tell. Interosseous means when two bones are there, between the two bones, when two bones are there, between the two bones there lies an interosseous membrane, and the interosseous membrane को supply करने वाली artery is called as interosseous artery. In which we have two interosseous artery. We have an anterior interosseous artery which is again a branch of what? It is a branch basically common interosseous artery. It is common interosseous artery which is a branch of ulnar artery. So as you can see, ulnar artery is there, and this ulnar artery ka branch is a common interosseous artery. In that common interosseous artery further give three branches: anterior interosseous, posterior interosseous, and the recurrent interosseous. Are you understanding? This is, for example, the ulnar artery. Ulnar artery is given a branch which is called as a common interosseous branch, and this common interosseous branch is again given three branches: anterior interosseous, posterior interosseous. Posterior interosseous of course will be posteriorly. This is anterior interosseous, that's a posterior interosseous, and a recurrent interosseous artery. In this recurrent interosseous artery, anastomosis with the posterior descending branch of the profunda brachii of the brachial artery. So that is basically known as a elbow anastomosis. These anastomosis are important because elbow anastomosis basically takes place between the four anastomosis we can see, and that's why the brachial artery is important, because ultimately these all are the branches of brachial artery only. Next what we have is basically this: in front of lateral epicondyle of the humerus. For example, that's the humerus. So this is the humerus, and in front of the lateral epicondyle of humerus what we have is basically the radial artery. Radial artery in front of the lateral epicondyle, and radial artery will anastomose with the radial recurrent artery, that is anterior branch of the profunda brachii artery. So radial with through the anastomosis. Anastomosis means joining part. So radial recurrent artery will anastomose, that is joint the supply between radial artery and anterior branch. Then this behind lateral epicondyle we have posterior interosseous artery. This posterior interosseous artery is basically will anastomose recurrent interosseous artery. So recurrent interosseous artery will basically anastomose the posterior interosseous artery with the inferior ulnar collateral artery. As you can see here, inferior ulnar collateral artery, and that's basically anterior ulnar recurrent artery. So it's with the posterior branch of profunda brachii with the recurrent interosseous artery which anastomoses with the posterior interosseous artery. As you can see in this diagram, posterior interosseous artery is getting anastomosed with the help of recurrent interosseous artery to what? To the posterior descending branch of the profunda brachii artery of the brachial artery. Then this is the in front of medial epicondyle. These are about lateral epicondyle. In front of medial epicondyle, ulnar artery, anterior ulnar recurrent to inferior ulnar collateral, superior ulnar collateral behind the medial epicondyle to the posterior ulnar recurrent and ulnar artery. Now our next topic is arteries of hand. In arteries of hand, what we have are the basically arches. It is very important. Arches, that is radial and ulnar arteries, will form basically two arches. One is a palmar arches divided into a superficial and deep palmar arches. So basically this is known as a superficial palmar arch. This is the superficial palmar arch, and this is basically the deep palmar arch. So what we have is basically that's the radial artery, that's the ulnar artery. Radial artery ka this branch is known as basically the superficial branch of radial artery, as you can see over here. And what is known as this is the deep palmar arch. So deep palmar arch and princeps pollicis artery. This is a very different artery. So here the superficial branch of the radial artery. From that what we have is this is known as a princeps pollicis artery, and this princeps pollicis artery. And what is this? C is basically common digital arteries, and P are the proper digital arteries. So these are the proper digital arteries. These are the common digital arteries. Why these are called as common digital arteries? Like this digital artery will supply both of them. Therefore, it's called basically C common digital arteries. So basically, that's the radius indicis artery. That's the princeps pollicis artery. What is important to know is over here that see in this diagram, this is a very manual diagram drawn by me. For example, this is your hand like this. So in this hand, what is important to know is there are going to be two branches. That is, this is going to be the branch known as a basically radial artery. So let's what name it is. It's a radial artery. Now this radial artery is going to give a superficial branch. Okay, that's the flexor retinaculum which is there. It's going to basically give a superficial branch, and this superficial branch, radial artery is going to give a basically superficial branch. This superficial branch is like moving over here. Now what's important to understand is that this superficial branch is going to give one more branch that is known as a deep palmar arch formation for it, and also it's going to be one branch which is known as princeps pollicis artery. This princeps pollicis artery goes like this. It's basically for the thumb. So princeps pollicis artery, it has this one, and here is two two branches. So that's the princeps pollicis artery. And then what we have is this one, then the radialis indicis artery, one more branch of it of the arch, that is this is known as a radialis indicis artery. So princeps pollicis artery, radialis indicis artery, princeps pollicis artery and radialis indicis artery. Now what we have next over here is this. These are known as a common digital arteries. So in total we have 4 common digital arteries like this. So that's a 3 common digital artery. So 1, 2, 3, because they commonly supply the 3 fingers. So I'll name them like this. These are the basically 3 common digital arteries, 1, 2 and 3. And this is the radial indicis artery, and this is basically the princeps pollicis artery. Now after the common digital artery, what we have next is this one, proper digital arteries. So we in total have 5 proper digital arteries. That is, once the common digital arteries pass like here, the branches it gives are known as a proper digital artery. So this is proper digital, that's proper digital, that's proper digital, that's proper digital. So in total we have 4 proper digital arteries, and the 5th one also comes there. So in total we have basically 3 common digital arteries, and we have 5 proper digital arteries. We have 1 princeps pollicis, 1 radialis indicis artery, and these arteries, all of them are branch of a palmar arch. So we have basically 2 arches. What we have, one is a superficial palmar arch and a deep palmar arch. A branch of the radial artery forms the basically the superficial palmar arch. You can see, I'll draw by this, wait. So that's the superficial palmar arch. You can see over here, that's the superficial palmar arch. And then what we have is this ulnar artery. Here the ulnar artery will basically join the superficial palmar arch, and also it will give one more branch which is known as a deep branch of the ulnar artery. You can see this diagram. This is ulnar artery, it has joined with the radial artery to give this superficial palmar arch, this anastomosis you can see, and this ulnar artery is now giving a branch which is known as basically the deep branch of ulnar artery. And this deep branch of ulnar artery is basically going to anastomose with a branch of with a superficial and deep branch of or we can say with a one branch of superficial branch of radial artery to form a deep palmar arch. So you can see over here in this explanation that radial artery course goes into the anatomical nerve box before reaching the flexor retinaculum. So you can see here it has went to the anatomical nerve box. Anatomical nerve box is this place, guys. See, I show with my hand. Like guys, this. Okay, I'm unable to, but basically the place I'm showing this, that's known as the anatomical nerve box, and that nerve box after that before entering the flexor retinaculum and passes between two heads of first dorsal interossei. What is this? Radial artery course. Then it passes to two heads of first dorsal interossei, and then it forms the deep palmar arch. Can you see? It has passed between two heads of first dorsal interossei and completed by deep branch of the ulnar artery. So it has been completed by deep branch of ulnar artery. This forms the deep palmar arch. It passes between and then dorsal interossei first, and then anastomosis is the deep branch of the ulnar artery to form basically a deep palmar arch. Now what we have next is basically branches. Pollicis princeps, main artery of thumb, and radialis indicis, radial half of the index finger. Ulnar artery, basically the course we can say it goes superficial to flexor retinaculum. As you can see over here, it does not goes anatomical nerve box and then flexor retinaculum and all, but it goes superficial to flexor retinaculum, and it forms a superficial palmar arch. As you can see, ulnar artery is forming the superficial palmar arch, and it basically getting anastomosed with the superficial branch of a radial artery. So superficial to flexor retinaculum compared with superficial branch of radial artery. Branches being 3 common digital artery and 2 proper digital artery each, and basically 1 proper digital artery. Now what we have is arteries which are superficial to flexor retinaculum or ulnar artery, and superficial branch of the radial artery. So these two arteries, that is ulnar artery and superficial branch of radial artery, these two arteries are basically what we can say is those are superficial to flexor retinaculum, and metacarpal arteries connect the deeper palmar arch to common digital arteries. So you can see this is the deeper palmar arch, and this is the common digital arteries, and the metacarpal arteries, the arteries which connect the two. So you can see in this diagram, what is this? Identify. What is this? That's the deep palmar arch. That's the superficial palmar arch. Deep palmar arch is basically formed by basically the radial artery. Yes, radial artery ka deep branch, and also radial artery and ulnar artery in continuation. You can see ulnar artery ka deep branch. Basically what completes is basically deep branch of the ulnar artery. You can see over here, it is being completed by a deep branch of ulnar artery. Yes, yeah. I don't know guys why clarity issues are there, but yeah. Okay guys, it's good now. Yeah, deep branch of ulnar artery forms the deep palmar arch, and it's important to know this. And what is this? Superficial palmar arch. Yes, deep and superficial, and basically it's formed by the superficial branch of the radial artery, and it's completed by the it's basically formed by the ulnar artery, and it's completed by superficial branch of radial artery. Then you can see here, what is this? This is what is this? This is radial artery, superficial branch. This is the principes pollicis. What is this? Radialis indicis. What is this? Deep superficial ulnar branch. These are the metacarpal arteries. Can you see guys? Yeah, these are the metacarpal arteries which join the common digital arteries with the deep palmar arch and pass in spaces between metacarpals. And what is this? Deep branch of the ulnar artery. What is this? Ulnar artery. And what are these? These are the common digital arteries. So you can see in this diagram guys. So yes guys, anatomy doesn't end here, it's just the beginning. And here we discussed about important arteries and important courses and arches of hands and this and that. But still, a lot important part is remaining, and the next part probably would be about axilla and clavipectoral fascia and the most important plexus of the upper limb, that is the brachial plexus. So stay tuned and thank you so much. I think in this video I read everything new. A more kind of diagrammatic representation was less. I put on a less stress on notes, but here I made sure that diagrams were much self-explanatory because yes. Okay, thank you. Not discussing more about it. Yes, have a nice day. Bye.